Diabetes Connections is brought to you by the only ultra-rapid-acting inhaled insulin and by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Sims.
Welcome to another episode of Diabetes Connections. Always so glad to have you here. I am your host, Stacey Sims, and we aim to educate and inspire about diabetes with a focus on people who use insulin. A few weeks ago, I put together a panel of some of the early users of Omnipod 5. The idea was to get a feel for how the system worked in the real world. It was a fun and really good chat, but it raised a bunch of questions. So I reached out to Insulet, the makers of Omnipod, and talked to their Director of Medical Affairs, Alex Wynn. After some back and forth with trying to put these conversations together, I thought maybe 2 different episodes, but I decided it would be more comprehensive and an easier listen to just put them both in one. So this is a longer episode than usual, but I think it was the right call. You tell me. We were fortunate to speak with Insulet earlier this year, just after the FDA approved Omnipod 5, and we really went point by point through the system. So we're talking about a lot here, but we're not rehashing everything. So if you missed that episode, you can find it at diabetes-connections.com, and I will link it up directly in the show notes here as well. We'll dive right into our panel and our interview, but first, Diabetes Connections is brought to you by Afrezza. When it comes right down to it, there hasn't been a lot of innovation for insulin. Sure, there are different brands, but nothing really unique when it comes to insulin delivery, except for Afrezza. Afrezza is unique because it is the only ultra-rapid-acting inhaled insulin available. It starts working quickly without the need for injections at mealtime, and once you breathe Afrezza into your lungs using the inhaler, insulin appears in your bloodstream in less than 1 minute, and it may start reducing blood sugar in about 12 minutes. Find out more. See if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium, and is not for patients with chronic lung disease such as asthma or COPD, or for patients allergic to insulin. Tell your doctor if you've ever smoked, ever have kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. You're going to hear first from a panel of 3 people, all lay people. This was a lot of fun. We taped it in July. You will hear from 2 moms of kids with type 1, one younger and one a teenager, and one young adult who has type 1 herself. We are taping this just in a room at a conference center. This is at Friends for Life. And I will share some photos of what went on in the Facebook group. But we start with everybody just introducing themselves.
Hi, I'm Sam. I was diagnosed 4 years ago on July 23rd, and I've been on the Omnipod 5 for about a month and a half, almost 2 months.
Hi, my name is Liat. My son Idan was diagnosed almost a year ago, July 16th, and we've been using Omnipod 5 for about 3.5 weeks.
I'm Stephanie Williams, and my son has type 1 diabetes, and he was diagnosed December of 2016, and he has been using Omnipod for almost 3 years. And Omnipod 5 he has been on for 2 months.
So Sam, let me start with you. What did you hope for Omnipod 5?
So, as someone who plays a lot of sports and is very active, I knew that I didn't want a tubeless system. So I was on the Omnipod, or I didn't want a tubed system. I was on the Omnipod, the old one with the big clunky thing, for a year. Then I was on the Dash for, I think, a year and a half, maybe 2 years. And then when I found out that there was a closed loop system that would connect my Dexcom, which was my favorite device, I found out that the 2 of them could communicate and it would just make my life easier. I was so excited for that. I was just excited to be able to play sports without my teammates constantly worrying if I would be okay. I was excited that my adrenaline spikes from when I rode on the exercise bike or did anything, my adrenaline spikes weren't just gonna keep going up, they would be treated. And I was excited that I could finally drink sugary drinks again. I know that's a weird one, but in Disney I've already had the jungle juice they have at Boma. I've had the Sipabration, which is like regular lemonade and a very sugary, like bath bomb looking thing. And I drank that and my sugars didn't even go above 160, which was perfect. One expectation I did have with the Omnipod was that I was expecting it to work right away, which is, I think, something I want to tell everyone. It takes at least 3 pods to get used to your body, 3 to 5 I found, but after the 5th pod that I had on, it was just like a miracle. It was perfect.
That's great. Yeah, we'll definitely talk about that because every algorithm is a little bit different.
Yes.
When I say every algorithm, I mean the different pump systems. And so Omnipod 5 definitely has its own idiosyncrasies. So Liat, what were you hoping to get out of Omnipod 5?
I wanted to sleep. As a mom of a type 1 person, I have not slept for a year now. So since he was diagnosed, we wake up between my husband and I, and we rotate shifts. We wake up 3 to 4 times a night to correct and to give juice and to just check and make sure that he's not dropping. He was honeymooning for probably about 3 to 4 months after he was diagnosed. So those massive drops in the middle of the night of 60 plus points were really scary. So just, even when you do sleep, you're not really in that deep sleep. You're just on that cusp of waking up because you're listening for that alarm. You're waiting for that phone call from Sugarmate. And so, just to be able to sleep was really what I wanted. And I have to say that even though we've had a few blips with Omnipod 5 so far, the nights have been smooth sailing. They've been a straight line, and that's been a blessing, huge blessing.
That was the first thing we noticed too when we switched to an automated insulin delivery system, is those nights.
Yeah, it's beautiful.
Perfect. That's great. Stephanie, how about you?
Well, I just wanted to make sure that his blood sugar stayed more within range. He was running a little high. He's 15, so the hormones cause a lot of elevations in his blood sugar. Of course, we just wanted to make sure that it was a lot more sleep for our family too, because we hadn't slept since he was diagnosed in 2019 or 2016. So I just felt that was, I don't know, I just felt like that was a big change with us, and we've been very pleased. And as you had said, Sam had said earlier about it took several pods for it to get more within range, I guess, due to the algorithm. Unfortunately, Brenner was diagnosed with COVID the 3rd week. He had his pod on, so the new pod. So actually, the algorithms have taken a little bit, I think, longer with him, but we have been able to sleep at night. Just unbelievable. I mean, we've only had 2 lows that were basically due to too much insulin put in for his carbs, and it was just one of those things. He ended up not eating as much, so of course we didn't fall too low, but just a little bit to keep us awake. That's okay though. We expect that.
I just want to be clear. You said something. He was diagnosed with COVID, or he was diagnosed during COVID?
No, he was diagnosed with COVID.
Oh, so
he was running a lot higher than normal. His 3rd week that he was wearing the Omnipod 5, so that actually played a big role in how his algorithms. I think it's just taken a little bit longer to get him more regulated as far as his blood sugar when he's.
Sure. It's learning you, and you're in a different state. That
yes. But this is his 3rd Omnipod system. He started on the Euros, then he went to the Dash, and now he's with Omnipod 5. And he was the first patient at his endo's office at Nationwide Children's to get it, and first one to get the prescription, first one to get it, and we just couldn't be happier. We were very fortunate, and I'm so thankful for this system.
Much more from Sam, Liat, and Stephanie coming up, but you may already have some questions. I know I did. So I asked Omnipod's Director of Medical Affairs to join us. From here on out, we're going to alternate spending time with him and with our panel. Alex Wynn is also a registered dietitian and a CDCES, a certified diabetes care and education specialist.
Well, thank you for having me. I'm super excited. I know there's a lot of questions out there to answer.
Before we jump in and start addressing all of them, can I just ask you, how is it going? I know it's an exciting time for the company. From your perspective, how's the rollout going? What's the reaction been?
I mean, as you can imagine, it's big, right? We're super excited. We recently went into our full market release of Omnipod 5, and the feedback has been overwhelmingly great. Lots of people in the community are talking about the opportunity to start up Omnipod 5. And we're just really in this focused mode on executing the most successful launch as possible.
So I'm curious, when people start on Omnipod 5. And as you said, it has just gone for the wider rollout. So I know it's just at the beginning here. What are some best practices that people should keep in mind? I am sure there are common questions that have come up.
Oh, absolutely. Yeah, it's a really great question about what is the best practice to start the system. And I think the best answer to that is maybe give an overview of how the system works. I think that's probably one of the biggest best practices I could probably provide is really that the user should really understand what Omnipod 5 is and what it isn't. At a really general level, Omnipod 5 is a two-part system with an added CGM. So what we have with our system is an Omnipod 5 app that can either be ran on the Insulet provided controller that you get in your starter kit, or if you have a compatible smartphone, you can run the Omnipod 5 app on that. You have a pod that's very familiar. It's the same dash pod in size and feel, but it's a bit smarter now with our Smart Adjust technology. What the Smart Adjust technology allows us to do is it allows us to act as a receiver for the Dexcom G6 CGM. So we connect directly to the Dexcom G6 CGM on body. This Smart Adjust algorithm is able to take those CGM values and make treatment decisions. And what's cool about it is what the system does is it looks at what the CGM values are, makes a prediction on where the user is going to be at 1 hour into the future, takes into account several other parameters within the algorithm, and makes a treatment decision every 5 minutes. So every 5 minutes, the algorithm is really making an adjustment to make sure that that user is pointed in the right direction with their target glucose.
It's a lot to keep in mind.
It's a lot, yes. It's very technical. If I were to kind of bring it down a bit into an explanation to a potential user thinking about advancing their care from a DASH system, and maybe they're on DASH and already a CGM, is that it really adds a lot of logic to the basal interaction of their system. Right now, when you're using just an regular insulin pump, you set the settings. The settings are going to deliver no matter what, unless you make a change. With this system, it's a lot smarter. It's looking at your CGM values. It's also making some decisions based on where you're going and headed and where you are now.
When you're coming from DASH, is there anything in particular to keep in mind? I mean, I guess what I'm asking is, for those who have used Omnipod before, we mentioned coming from DASH, which is the system right before Omnipod 5. Anything in particular that those folks should keep in mind, knowing that I'm about to ask you about people who've never used it before or might be coming from another type of pumping system?
When we were developing Omnipod 5, we really thought about our user base, specifically our DASH user base, because it was quite sizable at the time as we were developing Omnipod 5. And what we knew about DASH was that DASH was really easy to take on, right? It has a very intuitive user interface. So people coming from MDI or other pumps found it very easy to start the system up since it feels very app familiar, very close to the technology that people are already using with their smartphones. And thinking about Omnipod 5 and thinking about that transition user, what we kept was really the same essence of DASH as a platform and added on Omnipod 5. So anybody that's able to download the simulator app that's available today, you could download the simulator app and actually feel how the Omnipod 5 app is.
What about somebody who's coming from another pump system? In fact, let me ask you, what about people, because I've seen this happen, people coming from another automated insulin delivery system like Medtronic 670 or 770 or the Tandem Control IQ? These are all very different algorithms.
Yeah, I think there's the use side and there's the therapy side that we should probably distinguish, right? So I think from the use standpoint of actually picking up the device and using it as far as button pushing, getting to automated mode, delivering a bolus, no concerns there. Even from a person that's naive to the product, we've done so many usability studies to really iterate the product to the point it is now. And we've also undergone several human factors validations to make sure that the system's usable, right? That somebody from any transitioning therapy is going to be able to use the device. Now, I think from a therapy standpoint, there needs to be some discussion between the user and their HCP on the ideal settings that they need to put into the Omnipod 5 system. And in that discussion, there's a need to evaluate how insulin is being delivered on their transitioning device, how they're delivering boluses, what's their bolusing behavior, how they're utilizing the features on their current device, and thinking about what that workflow is and how that would translate over to the Omnipod 5. And to me, that's a very important discussion because that could really set somebody up for earlier success in the system. But the good news is if you don't have that early success, you'll eventually get there the way the system adapts. And we could talk more about that.
Yeah, I'm curious. I've used my family as an example, using a completely different system, but an automated or partially automated system the first couple of nights, Benny had crazy lows. We really had issues because we realized that the settings were all wrong in the pump, right? We were using it, we were helping it so much because these, they were not smart. I wouldn't call them dumb, but they weren't smart. And so the patients, users, parents, we were all doing more work, and you kind of have to back off on these systems and let them do their job. So that's my very much layperson description. So maybe you could talk a little bit more about how you like to describe it.
I think your layperson description is really how everybody's experience is in general, right? Currently there are 3 FDA cleared AID systems on the market. And I think the good news is that they all work differently, the algorithms. And I think it's the bad news that they all work differently, right? Because to a lay person that may be currently utilizing an AID system, and over the years using the system, you get accustomed to a certain workflow on how to make that device work for you. And so when you switch to another system that's still under the category of AID system, sometimes you have that expectation that it's going to be seamless. So with those transition points, I do think there's always going to be that warm-up period to understand how your workflow needs to change a bit to really work with how this system logic is, right? So, what we're seeing from our current users is that usually within the first 3 or 4 pod changes, we start getting closer to that, what I'm calling the success sweet spot, where we're getting closer to the time and range expectations. We're getting closer to what the user is really wanting to do as far as take on as their portion of their diabetes care and what is taken on by the automation from the system.
I do want to just clarify, because I got this question a lot. Omnipod 5, when you first program it with your healthcare provider, you are still putting in user information, including things like basal rates, right?
Yes, that's correct. The startup of the Omnipod 5 system is very similar to the Omnipod Dash system. So the settings that you might have in your Dash PDM right now, or you do have in your Dash PDM right now, most of those will be transferable over to the Omnipod 5 system.
Let's talk a little bit about how the pump learns the user. What's going on inside there? What does it mean that it's learning?
Yeah, Stacey, I love this question. Learning could be misinterpreted by many people, especially when you talk about algorithm and just what, machine learning is, right? So, in the context of Omnipod 5, we adapt. So the insulin delivery will adapt over time based on insulin delivery history. So essentially what happens is when you first start up the system and you enter the user, your first basal program. So let's say most people have one basal program, and they enter that basal program. The system will initiate based on what those settings are when you initiate the system. Now, what that allows you to do as a user is that once you have the pod set up and the CGM set up, you're able to go into automated mode in that same moment. So there's no time period where you have to put the system on and wear it in manual mode for the system to allow you to go into automated mode. We allow you to go into automated mode on pod 1. Now, during pod 1, the system starts to gain actual use, right? Because you're delivering boluses, automated mode is working. And once you change that pod to the next pod, you are starting what we call the adaptive basal rate. And the easiest way to think about this is that it's like a baseline insulin rate that's adapted from your previous insulin delivery. And with each pod change, that rate will actually change slightly based on what your current needs are. So this helps the system really provide a current relevant insulin delivery amount every time a user changes their pod.
Does it ever get to the point where if I looked at it maybe 2 months down the road, it's not really using my initial basal rates that I programmed in? Because like I said a couple minutes ago, ours seemed to be wrong because we were kind of over helping the pump before we got the smarter system. So if I looked at an Omnipod 5 user, could the basal rates be completely different a couple of months down the road?
After that initiation with the user entered basal program and the system changes over to using the adaptive basal rate, it really doesn't have an interaction, a very close interaction with what that basal program is anymore. So with this system, once you start using it, it doesn't make any changes if you do any modifications to your basal programming. When you do any modifications to your basal program, you still have the freedom to do so, but it only will affect your care in manual mode, not in automated mode.
Oh, that makes sense. So in other words, if for whatever reason you go back into manual mode, it goes to the manually entered basal rates.
Yeah, and I think an easy way to think about this loosely is, if you go to manual mode, you're pretty much using Omnipod Dash. Right. If you go into automated mode, you're in Omnipod 5, right? So the Omnipod Dash users, if they kind of switch over and think, okay, well, this is the product that I used to be on, it's a good mindset. The misinterpretation about learning sometimes is that you misunderstand what learning means. You might start to believe that the system will know when you eat breakfast or know when you are going to be exercising in the afternoon. And the belief might be that the algorithm is going to somehow adjust because it learned all of your behaviors. It doesn't learn to that extent. It learns based off your insulin delivery history, which equates to what your adaptive basal rate will look like. So I think that's important to understand.
Much more from Alex coming up, but let's get back to our panel. They're talking about getting the system. Remember, this is July before it was in the wider rollout that it is now. Insurance issues that they had and more.
So I wanted to ask you all, you're like the first people, right, first in the hospital.
Yes.
So Sam, let me ask you, how did that happen? Did you just call every day?
So no, I wish I could tell you. It was all my mom's magic, honestly. I got home, and I'm a big online shopper. I love online shopping. So if I see a package, it has my name on it, I'm opening it because I think it's something I ordered. And I had ordered something a week prior that wasn't supposed to come for a month. And I saw a package that just said Sam Durante, and it didn't say Insulet, it didn't say Omnipod like it usually would. It was just a package that said my name, and I was like, oh my goodness, this is it. It's the thing I ordered. I can't wait. I opened it. I saw Omnipod boxes. They were purple, so I just assumed they'd changed the color because they changed the boxes frequently. And I just looked, and I was like, ugh, Omnipod. There's more medical devices. It's not the giant stuffed animal I ordered or something like that. It's not the fun thing. So I just closed the box and kept going on with my day. And my mom got home, and she looked at me, and she was like, did you look at the package that's downstairs? And I was like, yeah, it's just some Omnipods. And she's like, no, did you look at the package? I said, no. And she's like, maybe go open it. So I walk in, and my grandma's there, my dad is there, my brother's there. Everyone's watching me open this package, and I'm like, what is going on? So I open the package, and I look in, and it says, welcome to Omnipod 5. And the waterworks just went. I immediately just started crying, and I was looking at my mom, and I was like, what? I was like, how did you do this? What do you mean? For me? What? She said she had told the insurance company everything. I play sports. I go away to college, and it's scaring her that I'm in college. She just told them everything and how I would benefit from it. And somehow, miraculously, I was approved. And they rush shipped it. So the day that I was approved, the next day, I had it. And I had no idea any of this was in the works. My mom did not tell me. She didn't want me to know. She wanted to make it a surprise. And I opened that box, and I just started crying. The waterworks, full tears. It was incredible. But I owe it all to my mom for pestering the insurance company and telling them everything. I'm sure you guys probably know that side of it a lot better than I would.
Definitely.
Yes. So definitely had that issue of having to pester and having to call. And we were initially told that our insurance didn't cover it. They didn't yet reach an agreement with United Healthcare. And so I was calling our endo, and I was asking them to do the pre-authorization, and that wasn't enough. And we had to do an appeal, and that wasn't enough. And then they finally came out and said they've worked out a deal with Insulet. They're going to start approving it as of, they gave a certain date. And once that date came, 8 o'clock in the morning, I had not slept the whole night. And at 8 o'clock in the morning, I'm calling Insulet. They're like, well, it looks like you've been denied. And I'm like, run it again. They just said that it was approved. So they ran it again. They said, okay, you're approved, but now you have to call your medical supplier. Calling them, oh, well, we need a pre-authorization. Well, didn't you get one from our doctor? Well, that was denied, so now you need a new one. So calling the endo, they having to send one over. Then I'm calling them back, and they're like, give us 24 to 48 hours to process. I'm like, nope, giving you 1 hour. You could process it in 1 hour, and I need this device because I need to pack it soon because I'm going to Friends for Life very soon. And so I don't have time to wait, for weeks for it to ship. So we drove probably 2 hours to a pharmacy that had the kit. My husband, rush hour traffic, running back at 9 p.m. We had just done a pod change for my son earlier that day. So when we got the 5, he was all excited, and he was like, do we have to do another pod change? I said, yes, we are, because Mama's sleeping tonight. And we changed the pod right there and then, and that was great.
This is the funniest thing. So I apologize, but we are in a room where basically I have snuck into this room to do this interview, and the lights are going on and off. And I don't know if that's within our power to change. You guys are being troopers because it's dark and then it's light, so we're just going to barrel through the best we can.
Hey, they can't see anything. It's okay.
Yeah, they can. Yeah.
I'm sure there's a camera in here.
There totally is.
But they can kick us out. We're just nice ladies telling stories.
That's right.
So thank you for your perseverance, ladies. How was it for you, Stephanie?
It was exactly the same way. Ironically, Brenner had an appointment with his endocrinologist on May the 2nd, I believe, the Monday. And it just so happened that was the day that she had just received the email that she could go ahead and start writing the prescription for the Omnipod 5. So he just happened to be her next patient. She walks right into the room and she said, and after multiple messages I had sent to them requesting a prescription for that to be sent, obviously it hadn't been released to everybody yet. So he was the first one to find out, or we were, sitting in the office. It just was pure luck that we ended up being her first patient, or he was, and she came in, she wrote the prescription and said, please follow up with me every step of the way because I want to know everything about it. So we have done so. It has been amazing, but we did go through a lot of the same situation with our insurance. We had sent it in, we needed the prior auth and everything, and we were told we didn't, we were told we did, but luckily we got it all approved and he was wearing it within like 8 days of that, so maybe 9. But we were very happy, yes. But it took a lot of staying on top of it and making sure that everybody with every point of it did their part. And
you guys are amazing. Like moms with children with type 1 diabetes, like I could never, I don't even know what goes behind the scenes. So just hearing a little bit from you guys and hearing from like the opening speeches here, just I don't realize how much my mom does for me. And it's like,
yeah, but seeing what you all go through.
Yeah. How old are you again?
I'm 19.
No, when you were diagnosed.
Oh, when I was diagnosed? It was right before my Sweet 16. It was my 15th birthday. And my mom still let me have the Sweet 16. A week after my diagnosis, she still let us keep going to Disney because we had a Disney trip planned. We brought a food scale with us, so that was really fun. I would laugh at me now, but it was.
We all do that the first year.
Yes.
Oh, the first year we had boxes of sugary cereal coming on the plane, and we're like, we need it. She's diabetic. And
I love talking to these ladies. Okay, since we started talking about insurance, I thought I would ask Alex about the benefits and coverage side of things. How's it going? Are there more systems? And how should people navigate this if they're not sure?
Yeah, it's a great question because how good is the system if you can't get it, right? Or you don't know how to get it. So first I'll start off by saying that Omnipod 5 is unique in the fact that it's only accessible through pharmacy. There's a lot of benefits to a user as far as it being only available through pharmacy access. For example, a user doesn't have to be tied to the current contractual obligation of their current traditional insulin pump, right? They could, go onto Omnipod 5 and obtaining that prescription through pharmacy is very similar to as if they're getting their insulin, right? So they could start getting their pods through their retail pharmacy, or they could get it through mail order just like they're getting their insulin. The other good thing about it is there's no obligation for the user to actually be on the product for a certain duration, like a contractual duration. So if they start using the product and after a year something changes, they have the flexibility to kind of maneuver their care differently than the conventional, 4 or 5 year warranty period. The way a person could understand what their coverage is they can go right to our website, omnipod.com, and look at the get starting pathway or the upgrade pathway. So the get started would be somebody that is not using an Omnipod product at all, where the upgrade path would be somebody on an Omnipod product that's looking at getting an Omnipod 5 product. So how it's going so far, we are at about 55% of covered lives at this point since our full market launch. And that is actually further along than we were with Omnipod Dash at the same time post-launch. So we're really working hard to keep improving that access for users, but it's going to take some time for it to get to that higher percentage since it's a new product.
And, it's one of those things where folks may not even realize, and I had a coworker do this, it wasn't diabetes related, where they went to their employer and said, can you help me with this? And the employer was able to put the item on the health insurance. Sometimes, not always, it's not always that easy, but people can ask that too, right? If they have employer health insurance.
Yeah, we've heard a lot of different ways our users have gained access through their employer insurance coverage and different ways they've maneuvered the system to get to their access point. I don't know all the anecdotes to get there, to be honest with you, Stacey, but I know that people are very creative on how to get there. Our goal as a company really is getting us to the point where we don't have to get that creative, that we just have a really high percentage of covered lives under pharmacy benefit.
No doubt. I understand you'd have to be careful, but we are a creative and persistent bunch, that's for sure. I appreciate Alex answering that. It's really not his department. But I do think, I've talked to a few people about this, that just asking your employer, the person at your work who handles the healthcare stuff, is a good way to see if you can get more coverage. It's at least a good place to start. If you are not sure where to start, Omnipod has forms on their website, whether you are new to the whole system or if you're coming from Dash or an earlier version of Omnipod, and I will link that up in the show notes. We're going to go right back to our panel in a moment, but first, Diabetes Connections is brought to you by Dexcom. And we've been using the Dexcom system since Benny was 9 years old. We started back in December of 2013, and the system just keeps getting better. The Dexcom G6 is FDA permitted for no finger sticks for calibration and diabetes treatment decisions. You can share with up to 10 people from your smart device. The G6 has 10-day sensor wear and the applicator. It's so easy. I have not done one insertion since we got it. Benny does them all himself. He's a busy guy. He's a senior in high school this year. He's also working and, he's just balancing a lot. And knowing he can just take a quick glance at his numbers and make better treatment decisions is really reassuring. Of course, we still love the alerts and alarms and that we can set them how we want. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. To learn more, go to diabetes-connections.com and click on the Dexcom logo.
I'd like to talk hardware for a minute because one of the questions that I've gotten from a lot of listeners has been about what's different. Are any of you able to use your phones with the system yet? I know there's a different controller. You're nodding, Liat.
Yes. So we actually had our PDM break about a week and a half afterwards. So after we had just gone to like pod 3 or 4 and we were like golden, it broke, and then so a quarter of the screen wasn't usable. Then the next day it broke again, making it completely useless. And I couldn't wait for the next PDM to be shipped to us. So I just linked it through my son's phone. So he has the Galaxy S10, I believe. And so we had linked it to that, and he's been using that since. We have a backup PDM now, just in case, but that was one of the frustrating things is now we have to go back to pod 1 because it's the new setup.
Oh, really?
So, yeah.
How is it on the phone? Do you find it's as easy as the old PDM?
Yeah, it's just as easy. Yeah, it's just as easy.
Okay.
It's great.
Is it similar? We're not pod people, so I shouldn't say pod people. Obviously, I don't use
Podders,
it, so I'm not familiar with the whole Podder thing.
Yeah.
Is it comparable? Are there any differences on the phone that you want people to be aware of?
There's nothing different. It's the same exact setup. It looks exactly like the PDM would look, so it's easy. It's all touch screen, so yeah.
Great. And you said that you did not, Sam.
I have an iPhone. I'm a very big iPhone person. Mac, AirPods. I can't switch now. So it's not available for iOS yet, but they said it's in the works very soon. So I use the little, I call it my diabetes phone, but I use the PDM device itself. And my favorite part about it is that it says my blood sugar on it right there. So it connects directly to the Dexcom, and it'll say my blood sugar right on the PDM. So there have been times where my phone has been close to dying, and my friends are like, let's go out to the pool, and we're in the hotel room. So I've been able to just plug my phone, that's usually like my lifeline, I've been able to plug my phone in at the hotel, walk to the pool with my PDM, and still have my blood sugars right there, and it's really incredible. It really is. Here, I can take out my thing so I don't miss any important points about it.
Oh, that's okay.
Because I have it, and it's very
Yeah,
fun.
It does look just like a phone. It's like an Android phone.
It is an Android phone. It's a lot, I guess something that's probably important for people to know, it's bigger than the Dash because it does a lot more. It's thicker and the screen is a lot nicer, and it's very sturdy, I feel. Very, very sturdy.
Are you using your phone yet?
No, because we are iPhone users too. So we're excited for the app to come out, and also to be able to see when he's not with us. They have the app that it's called View from the Dash, and we have been very dependent on that before. So that's one thing that they haven't come out with yet, but hopefully soon. So that way we can see when, Brenner goes ahead and he boluses for a meal, then, if he still has to, if we do an extended bolus, then I know how much that he has given himself. If he's not with me, I can still see it. So hopefully that'll be coming out soon.
So we're going to get in a little bit of the weeds here, and I just want to issue a reminder. Nobody here is a healthcare provider. Well, you're a nurse,
yeah, but
nobody's a diabetes educator. Nobody,
Correct,
right?
correct.
Okay, we're not talking as an expert. I want to just be clear that this is like mom
Yeah.
and person
Yes.
with diabetes talk. But I'm curious, you mentioned extending boluses.
Mm-hmm.
I don't do anything anymore, and Benny doesn't even let me see the pump, so who knows what he's doing. But I don't think we do extended boluses with Control-IQ. Is that something you've continued to do?
Well, we do.
And I don't mean to put you on the spot. I mean,
no,
everybody
I can
manages
honestly
differently.
say Brenner's very independent too
Right?
with his
You have no idea
care.
what they're doing anymore.
And I'm so proud of him because we've come a long way, But it's still, in fact, we haven't done it so much since he's been on this, maybe a couple times, just because we may forget to go in. We do you can do an extended bolus, but if he, say, is at school, then I don't know if he actually remembered to put it in his extended bolus, or if
he's just ripping it out and going beep, beep, beep.
Yeah, just
right in my
hurry and
pocket.
try. Yeah. So we really, if he's done it, I'm not aware.
That's fine. I mean, I'll give again from our example. When Benny was younger, and we'd have like a high-fat, big, like a Friday night dinner, we're
Yes.
going out to eat. I would give him like a massive amount of insulin up front, and then I would I would give a massive amount of insulin up front, and then I would actually increase the basal for like 4 hours, right? And that would really help even it out. But when you have an AID system, you're not doing those things anymore. It doesn't let you a lot of the time,
Right.
and it's doing the work for you.
Right.
Yes.
So
in this case, we don't have the ability to do extended bolus unless he's in manual mode.
Right.
So we used to depend heavily on extended bolusing when he was on the dash. We have not been able to do that because I don't want to switch him back and forth from automated to manual. So what I started to do was kind of do split bolusing. So I would give him that massive amount initially, wait like an hour, and then give him another good amount after that, just so because it takes him about 30 to 40 minutes for the insulin to really kick in. So that's how we've tried to solve it, but I would love to have extended bolusing for automated as well.
It's funny how we have gotten, I think, and this is my opinion, I think it's almost easier to enter these automated systems if you've never pumped before, because we are also used to manipulating this dumb pump, right?
Yes,
I mean, we
I
used
agree.
what I call a dumb pump. I mean, sorry, I don't mean to insult any
Yeah.
pump. For like 13 or 14 years.
Yeah.
And then we got the smart one. It was like, oh, we've got to leave it alone?
Yes.
That makes no sense.
It's almost impossible sometimes to do that too. I know, especially at night, if he has, especially during summer, his schedule's completely out of whack. So if he starts running high, if he eats late, if he's playing a game, anything, he eats late, high fat, that's a killer.
Yeah, I know. Those teenagers.
Yeah, yes.
You had mentioned like sugary drinks, which I
Yes,
know is like
yes.
a fun Disney treat for
Yes.
you. Do you mind sharing how you do that? Because that's
Yeah,
hard.
sure. It used to be impossible. I would never drink anything that wasn't sugar-free. I was hardcore unsweet iced tea. Even when I went to Nashville, I was like, I'm not trying the sweet tea because I know I'm going to want a glass of it, and I can't do that with like my current pump and all of that. Basically, I'll do, for instance, last night I went to Boma at Animal Kingdom Lodge, which was like delicious, and I recommend everyone goes. And they had their jungle juice, and it was just like pretty tall. It was like a tall glass of jungle juice, and I decided like I'm going to drink this. So I gave insulin, and I figured that was probably 80, 90, 100 carbs. So then I was considering what else I was eating. I was having ribs, I was having mashed potatoes, I was having black-eyed peas, and just a ton of
Can
stuff.
I just interrupt you and say, I love you. Like, thank you for sharing
Yeah, of
how you
course.
were eating.
Of course,
oh my
of
gosh.
course.
Okay, so continue.
I was eating all these things plus desserts. They had little zebra domes.
The best.
It was so good. Oh my goodness. And they had like cookies and cupcakes, and I was eating everything. I think I gave 155 carbs, and the highest I went was 157, and then it immediately flattened out to 150, and I finished the night at a unicorn, 100.
Wow.
I took a picture of it right as I was going to bed.
I just did Brenner's
finished at a
yesterday morning.
unicorn.
We woke up and he was right at 100.
Yeah.
I was like, wow, that's
Wow.
going to be a good
That's
day.
It was
amazing.
great. Like not even with the sugary drinks anymore. Like I ate pizza for the first. I'm from New York. Pizza and bagels are a huge part of New York, and it was always impossible to eat them. Anytime I eat a bagel, I'd go higher, I'd go low. Anytime I had a pizza, I'd go low like hours later.
Yeah.
I had 3 slices of pizza back home for the first time ever without having any issues whatsoever.
Wow.
I maintained under 200, and like going up to like 190, like that was fine. And that was a victory for me.
Sure, of course.
And I didn't need extended bolus.
Are you, just to be clear, are you pre-bolusing? Are you bolusing right before you eat, after you eat?
Okay, so the insulin that I'm on now, it's a pre-bolus 20 minutes before. But I got a trial on the new insulin that's like super fast acting, like 5 minutes before.
Like Fiasp?
Called like
Lumjev?
Lumjev, that. And I just got a prescription for it. So now I'm going to have the fast acting super insulin in the Omnipod 5 system. And I've been walking around telling people I have a pancreas. I've been like walking around looking at my friends and I've been like, I'm just like you now. I have a pancreas. I can eat whatever I want. I can do whatever I want. Like, this is great.
Jumping in because I left Sam's comments in about Lumjev, but I do think it's important to know that that type of insulin is not actually approved for Omnipod 5, and Alex confirmed that.
The insulins that are indicated for use with the Omnipod 5 system are Humalog, Novolog, and Admelog, and no other insulin should be used in Omnipod 5.
One of the things that I should have asked about earlier, probably just when we were talking about how the pods learn you, can you talk a little bit about targets and settings and, how much, if at all, people can or should personalize the experience? We're so used to having 18 basal rates and changing correction factors and having different profiles for different experiences. Can you talk a little bit about that?
A unique feature of the Omnipod 5 system is customizable target glucose values. You'll notice in other systems that this value is not customizable. Our customization is from 110 milligrams per deciliter up to 150 and 10 milligrams per deciliter increments. A user can also set up to 8 different segments in a day. So in a single day, somebody might say, at night, I'd like to be 120, a little bit more conservative. When I wake up, I want to go down to 110. After lunch, let's say I'm very active at work, so I want to go to 130 because I might be more insulin sensitive, right? So you have that ability with Omnipod 5 to change that target glucose value. How it's used is very interesting. When we started off the pivotal trial, we had this feature set, and we had a lot of investigators ask us, how would you best interact with this target glucose modification, especially in the upper values? And what we saw was that oftentimes a higher target might be chosen at initiation, right? You might have a user that needs to gain some trust of the system, especially if it's like an adult, a caregiver of somebody that's on it, maybe a pediatric patient. And they just want to understand how insulin delivery works. They don't want to go too aggressive on day one. So they might have started it higher at that point. And as they started using it, what we saw in the trial was most everybody got down to the lower target glucose. So the 110s and the 120s. And it's not shocking that our best time in range is seen in a lower target glucose of 110 and 120. So even those that started higher on it, what we saw eventually would come back down to the lower target glucose values. So I think that for the use cases of that is, initiation, if you have changes in your day that you want insulin to be more aggressive or less aggressive, that's where the target glucose comes into a good benefit for the user. I do want to say that the target glucose value in Omnipod 5 is the single setting that directly impacts how your algorithm performs. So when you tell the algorithm that you want 110, that directly impacts how the algorithm will deliver insulin. Everything else I consider more indirect because the system takes in all insulin, right? To think about what to deliver from an automated standpoint. But the most direct is your target glucose. The other thing I'll say about target glucose is that I think just this comes back to the setting the right expectations of the system is there's some frustration sometimes when people set it at 110 and they don't see that their glucose is at 110, right? Yeah. And that's a common complaint. And what I like to frame target glucose as it really is telling the algorithm how aggressive to be at certain parts of the day. If you remove the numbers and you said, aggressive to less aggressive, you're really kind of moving that dial along to tell and inform the algorithm how you want insulin to be delivered. So making that literal translation from target glucose to what you're actually seeing might drive you crazy. It's really just informing the algorithm on how to deliver insulin.
I don't know if you can answer this. I'm just curious. In years past, when I'm specifically thinking about when we used an Animas pump, we would set the target number manually correct down to this number plus or minus, and it would automatically plus or minus 25. Is that kind of what's going on with Omnipod, or is it really trying to get you to 110? And it's just because diabetes is tough and it's not exact, and there are ranges and people are eating and moving and that kind of thing.
That example of the Animas pump showing a plus or minus from that target value, it's different in how Omnipod 5 works. Now, there's two ways target glucose works in Omnipod 5. The target glucose is used by the algorithm, right, to really inform the algorithm on how aggressive it should be with insulin delivery. But the target glucose also works when you are delivering a bolus, right? So I think what you're referring to from the Animas pump, since it was not an automated system, was really when the user puts in a blood sugar and a carbohydrate amount and asks for a suggested bolus, what value is the system using?
Right.
So with this system, what value you put in as target glucose applies to both the algorithm and also the bolus calculator. So if your target's 110 and you bolus, it's going to be comparing you against a 110. So if you plug in a blood sugar that's 190, it's going to say 190 minus 110, and you are 80 points high, right? And it's going to calculate based on your correction factor and how much you need.
In addition to changing those targets, which is unique to Omnipod 5, are there other ways that you're finding people are trying to, personalize the experience even more for them? I mean, doing a little bit of a deeper dive into the settings. Again, we don't use it. I'm curious about things like, can they do anything else in terms of, correction factors or things like that?
It's a good question because everybody really wants to know where their interaction impacts their insulin delivery. And the good news about the actual use of the system and how the settings are used is that it's very familiar with how you would use Dash. So when it comes down to bolusing, there's no restrictions to the user.
Oh, okay. I'm curious, again, I don't know how you're going to answer this, but more experienced users are always looking for ways to, I'm going to say, work these systems, right? To kind of dig in there and get as much as they can to personalize it. Can you talk a little bit about how people might be able to do that? How much can we change what you're handing us to make it work for that individual user?
I love this question, Stacey. I was very close to defining the requirements. And we have a whole big innovation team looking at how we should build this system to really match the user's needs. And we do a lot of UX research, user experience research, to really understand the hot button points that users want from their AID systems. And there was a lot of decisions that we made that ensured that the user would have flexibility on how insulin was delivered, because you and I both know if you are too prohibitive, there's going to be a workaround that the community is going to find, right?
Yeah.
And that will be found on day one. So what you'll notice with Omnipod 5 is that the ability to bolus is really unrestricted. So there's a smart bolus calculator that's very similar to our Dash smart bolus calculator, but this one has the ability to pull in the CGM value, right? So with that, the user puts in the parameters that they want to inform the smart bolus calculator. So they could pull in a CGM value, they can manually enter what their glucose value is, they could put in carbs, they could omit carbs, they could just dial in how much insulin they want. They can manually say, give me 2 units, right? So from a bolusing standpoint, it's very flexible. Now, how the user really can modify the settings is very open as well. So the bolus calculator settings right now that a Dash user is used to, as far as strengthening an insulin carbohydrate ratio, changing a correction factor, modifying duration of insulin action, that's all there as well. But remember, those settings will only inform the bolus calculator, and it won't impact the algorithm delivery unless you're modifying the target glucose value.
Got it. It's interesting to hear a director of medical affairs talk about knowing how the community will just dig in there on day one. I appreciate you acknowledging that.
Oh, totally. I've worked with patients so long. I mean, diabetes has been the majority of my professional career. So I really know the user.
We'll talk a little bit more about that in a moment. In between doing the panel and talking to you, Omnipod 5 got approval from the FDA down to 2 years old, to toddlers. I had a child diagnosed at 23 months. Toddlers are a different kind of diabetes care. And I say that kind of laughing because it's really crazy with a toddler. Congratulations on that. You are, it's the youngest age group for any AID pump. Are there any differences? Is it the same exact system? Anything parents of littles should think about?
We're very proud of this indication change in the same year of our product clearance. I think that it really speaks to the safety and effectiveness profile of our algorithm. And the wild news is it's the same algorithm to address that entire population. For us to get that indication so early on for such a young age group that's very complex in their diabetes care, we're really proud of that safety profile and effectiveness profile that the algorithm provides with that audience. So to answer your question, no, it's the same algorithm.
As you mentioned, the Omnipod 5 works with the Dexcom G6, and I know you've already been talking to them. So when the G7 is approved and rolled out, you will all work together. We're not going to readdress that here. I know it will not be immediate. But what about the other companies? We've heard for a long time about interoperability with things like Libre or Eversense or the 30 other CGMs that are in the works. Are you all looking at working with any of these other companies going forward?
So the beauty of Omnipod 5 being an interoperable pump is that we do have the ability to partner with different CGM systems. So publicly right now, we've communicated that we are going to be integrating with the Dexcom G7. And we also have a partnership with Abbott to integrate with the Freestyle Libre. So our users will have choice on what sensor they want to use with the system.
I can't ask you about any kind of timeline, right? Because I know that the Freestyle Libre is something that people are waiting, not just with your pump, but with other pump companies. There's no timeline on that, right?
It's really difficult to promise timelines because of, submissions and approvals can be so unpredictable. But I will say that it is a focus for us. We know that there is a very broad population, especially internationally, that are using the Freestyle Libre system as their sensor of choice. So it is a focus.
I'm curious too, if there is an update like that or any kind of update that Insulet might make, is it easy to just kind of put that into a pod? I guess what I'm trying to ask is how do you update this kind of system? Tandem, you plug your hardware into the computer. Dexcom, they're able to just change the transmitter at the factory and send it out so people can have if there are updates on that, they just kind of send it out when it's ready. And on Omnipod 5, if there are updates, would people have to change their controller? Would they just change the pods? How does that kind of stuff work?
The Omnipod 5 system actually has data capabilities. When you use the Insulet provided controller, it actually has an installed SIM card. Additionally, it is Wi-Fi enabled, so a user can connect to their home Wi-Fi network. If you're using the device on your compatible smartphone, you're obviously connected to data and you're probably connected to your home Wi-Fi as well. What that has enabled us to do is to do over-the-air updates. So when we do have updates, we have the ability now to really send that out and the user would be updating the app just like they would any other app. And that update can include bug fixes, it can include feature enhancements, and it really helps us get ahead of changes faster than having to replace the controller. The other good thing about that feature is that you're not going to be sitting with the same device on year 1 to year 2 with the improvements that are pushed through over the air.
Got it. I would assume then if someone's using, maybe this is in the future, on a cell phone, it would just be an app update?
Yeah, it'd be very similar to that. So you would be informed that there's an app update and to install it and use the new updated version.
Pie in the sky, and I have my own answer for this too. What would you like to see? There's no news on Omnipod 6. I don't want to put it out there that they're working. I'm sure they are, but we're not really talking about something concrete. What would you like to see in Omnipod 6?
I want it to be flat. I have closed my pod in the car door before. I've had people walk past me, and I'm from New York. People will bump past you. I've had someone rip it off. I've playing Frisbee. I've had it when I slid. I've had it come off from sliding. I want it to be flat.
Got it.
Even if it's taking up more surface area.
Right.
Flat.
Okay.
I would actually really like it as a parent, to be able to bolus from my own device as well as from his, so that I don't always have to interrupt him playing and I don't always have to call him back to me. I can just do it from my phone, and if he's at school, he could do it from his, and I think that would be a huge, relief for parents.
So you're saying not just 2 devices, you want to be 3 miles away and bolus your kid.
Oh, that would be even better.
Yes, that would be.
Okay.
Yes, because if I could do it from home, yes, that would be great.
That's a lot of power.
Yeah. Stephanie,
Yes, I basically agree with both of them because Brenner has lost his pod many times, just activities of daily life, a lot less often than having a tube, though. It is amazing being tubeless, but also to be able to have the convenience of bolusing. I agree with both of them. Bolusing from a distance would be great, just in case he's asleep. I don't know where his pot or his PDM is or his phone at the time. Once it switches over to where he can bolus from his phone, that would be fantastic.
My dream is more in the algorithm.
Well, I should add that too.
Yeah.
I'm sorry.
No, go right ahead.
Yes.
Dream away.
Yes, definitely, because I feel like right now, and I know there's a lot to learn from all of this, but I feel like he's not coming down when he does go high. And of course, teenager, 15 years old, boy, he's going to be tending to be elevated more so, I think. And that has been an issue that I feel is very concerning. I would like to see him more in range. It does take a while for it to come back down. However, there has been a lot of good sleep nights now because he doesn't tend to drop low, but nothing compared to what it was like. It has been a game changer, but that is definitely one thing I would like to see even with this system is to get that more under control when he is running high. To
More
get
aggressive treatment
yes,
of highs.
definitely
Yeah, and get
quicker.
faster,
Yes,
yes.
much quicker.
Takes us hours sometimes as well.
Yes, yes.
I will say what I love about our system, and it's very similar, I'm sure, is that once they
That's
get that high,
beautiful.
rather than like rage bolusing and then they crash,
Yeah.
with these
Yes.
systems, you know that they're going to have a safe landing.
Yes,
That's right.
That to me has
absolutely.
really just taken a lot
I
of
think the
worry.
lowest we've gone is 68, which is
no, it's
amazing.
fabulous.
is.
So I would add, if I may, my change to the algorithm would be that it would be much more aggressive or
Yes.
something when they bolus late for
Yes.
meals or
Yes.
miss a meal.
Yes.
Because you're
Yes.
human beings,
Yes.
right? You're going to miss a meal. And I know that there are some companies that are already testing that algorithm. So that's what now that we've got these systems,
Yes.
I'm like, all right, what's next?
Yes.
Let's get
Or
the meal.
even
Yes.
like I've had a pod that like I gave insulin, I ate rice and a milkshake, and I had like a ton of stuff, and then the insulin was leaking out of the pod the whole time, and I had already eaten, and I pre-bolused 20 minutes before,
Right.
so I was like, oh, I'm gonna be fine, and then I like ate all these carbs, and then it was leaking, so I was like, oh my gosh, I have to give insulin after, and I put on the pod and I just injected because I knew it would happen faster. So I agree, if it was like almost like a forgiveness mode. That's what I'd love to call it.
I want to keep you just for another couple of minutes here because we've talked all about the Omnipod. We haven't talked about you. And you mentioned that you worked with people with diabetes for a long time. In addition to your title at Insulet, you're an RD. You are a certified diabetes care and education specialist. We used to call those certified diabetes educators. Tell me a little bit, Alex, why is this meaningful for you? I mean, I don't want to ask you to recap your whole career, but would you mind talking a little bit about why you do this?
I would love to tell you why I do this. So I think I've been a diabetes educator for at least 17 years now, so coming up on 2 decades. As a dietitian, I originally first started working in a long-term acute care and worked with patients in kind of improving nutritional outcomes at that level. But what I wanted more for my career was to do a therapy or really manage a population where I can see firsthand the difference from my interaction with them. So early on, I switched into diabetes care and got more knowledgeable into diabetes devices and really managing people with diabetes of both types and really throughout the life cycle. I've actually had the privilege to work with Insulet for 14 years. I've been here for every product launch from the first pod up into the Omnipod 5 system. I'm just at awe in the fact that when I used to work with the more conventional ways of delivering insulin, and we'd spend so much time looking at reports and making changes to settings, especially in the basal programs, based on trends and pattern management. And now juxtaposing that experience with what an AID system works, it really humbles you of what we tried to do with non-automated systems in the past, just to see how often these systems suspend at night to avoid hypoglycemia, and to think about how many users still have insulin running at those times of night with no change based on their glucose values. For me, it's just such a pleasure to be with a device that continually evolves and continually listens to the voice of the user so that we can keep innovating to improve the experience of managing this tough disease.
I hesitate to ask this, but I am curious. What kind of keeps you up at night? when you think about issues and problems for people with diabetes?
That is a great wild card question, Stacy. What keeps me up at night is accessibility. So right now, I work in our medical affairs department at Insulet. And what medical affairs really aims to do is we look at accessibility from a different sector of the business. So you might have our market access where they're looking at it from a payer access, which is very, very important. And a lot of our work feeds into that payer access strategy. But what keeps me up at night is what populations are not obtaining this type of technology for their care. What populations are not getting it and why? And how can we, from a medical affairs standpoint, really make the product in design or data to justify the need, make it more accessible for those populations?
That is a great answer. And the flip side of that question is, what gets you springing out of bed to go to work in the morning? What gets you excited about this going forward?
I think the thing that gets me excited the most are the little plugs of testimonial that we get out in the wild. You interviewing Omnipod 5 users, people being vocal on social media about their experience, good or bad, right? I think that we take it all in as a company and we really try to assess what we're hearing from the people using the product on the front lines. And that feedback is so unique. You know, we're in that place of opportunity for us to get direct voices from social media, right? Where if we were doing this 10 years ago, it'd be really hard to field that feedback that quickly. I think every day when we get those pieces of feedback, especially the ones that make us change trajectory or question what we're doing, that's what really excites me.
That's great.
I just want to say, like, my life would not be this way if I didn't have the 5. And I know it's only been a month and a half, 2 months, but I have noticed such a change. And there have been so many nights where I know my mom has texted me and she's been like, your sugar looks amazing. Over the past 24 hours, I was just showing them my graph. Over the past 24 hours, my blood sugar has not gone above 157. And that was after the jungle juice.
Wow. That's fantastic.
So I just want to say that I love the 5. And I just love the Omnipod in general. I just think it's really great.
I just cannot begin to tell you the changes and the improvements that we have seen, and that makes me feel good as a mom because I hate being on him all the time about it. Yeah. And, but I also want him to live a long, healthy life, and it's just so hard. It's just such a difficult situation to be in as a mom because I'm going to make sure that I support him no matter what.
And you're going to keep doing that.
And
I'm 19 and my mom is still on my case. I get texts if my blood sugar goes below 80. She'll be like, are you okay?
I do the same.
I still... she still carries around glucose tabs even while I'm 3 hours away in college.
Yeah. That's amazing.
She has them with her.
Yes.
So you guys are going to keep that and don't lose that.
Yeah.
Because I love seeing my mom texting me being like, hey, are you okay? It makes me feel so good that someone's there caring for me.
Oh, absolutely.
So keep that. It's very important.
I'm glad you have that support. That's important.
And I'm glad you guys are supporting them.
Yeah, I just wanted to say I'm most excited about going back to school in September because not having to reach out to the school to constantly correct him is, I think, going to take a lot of stress off of us and also from the school too. So I know his teachers last year were a little bit overwhelmed with the amount of times we had to text and say, he needs a correction. He needs a correction. He needs a correction. So we're excited. We're looking forward to all the upcoming changes.
Well, thanks for making time. I know everybody's really busy here. This was fabulous.
Thank you so much for doing this.
Yes.
They were so great. But I am going to give Alex the last word here. He had a few recommendations he wanted to make sure you know about.
Yeah, I would love to. The first thing that I like to bring up is I've heard from providers and read from users to really think about the Omnipod 5 system as a partner or assistant to their diabetes care. And I just think it's such a great way to put it because it does imply that your effort is still needed. But since you have a partner, things do become easier. So I really think that sets up the right expectation for users when they go into an AID system and an AID system like Omnipod 5. It's not a set it and forget it type system. You do have to interact with it, but you have a stronger partner with you in your diabetes care. The other thing I'll say is when starting the system the first time, really spend time to assess those settings with your healthcare provider. In general, the entered basal program should account for roughly 40 to 50% of your total insulin needs. And since you still need a bolus, it's important that your boluses make up the remaining insulin for the day. Starting off with the right distribution amount for your basal rate will really help your first footing in getting to that adaptive sweet spot. The other thing I'll say is users should expect that basal and bolus insulin distribution, it'll change. And what I mean by that is, right now when a user is using an AID system or maybe a non-AID system, they get accustomed to a certain amount of insulin that they're delivering. And typically they only see the amount of bolus they deliver. But with AID systems in general and Omnipod 5, you can see that distribution change. It's not uncommon for people using AID systems to need more bolus insulin. And I think that makes people panic a bit when, your typical bolus dose might be 3 units, but now it's 6. And you're thinking you're doubling your dose. But if you take a step back and you look at your total insulin delivered, you'll probably see that you're really close to the same amount daily that you were previously. It's just that you will be using less insulin on the automated basal end. It's very common for AID systems. So just expect that distribution to change and don't panic, work with your healthcare provider. The last thing I'll say is keep an eye on your care, but don't become a helicopter. Bolus when you eat carbs, correct when you feel you need it, and try to use a smart bolus calculator as much as possible so you avoid stacking. That smart bolus calculator will really look at what the automated basal delivery is doing. And if automated basal delivery has you covered, you might get a suggestion to not deliver a bolus at all because your insulin on board from the algorithm is really ramping up and you don't need to take another bolus to bring you down.
Alex, thank you so much for sharing so much of your time and so much information. Obviously, interest in this is very high. Congratulations again. And I really appreciate you spending some time with me.
Thank you so much for having me, Stacey. I really enjoyed our time.
You're listening to Diabetes Connections with Stacey Sims.
All right, more information, as always, at diabetes-connections.com. Thank you so much for sticking with it all the way here. Huge thanks to our panel and to Alex. We will definitely check back in with Insulet as they learn more about Omnipod 5 in the real world. They're doing a bunch of studies, and we will have to check in with them to get some updates further down the road. An enormous thank you to my editor, John Buchanan from Audio Editing Solutions. I think this is the first episode in more than 500 that we have done like this. And we work remotely, so I'm sending him snippets and marking things up and highlighting stuff and, sending him, 6 tracks of audio. So, John, thank you so much. I really appreciate you. And as always, I appreciate you for listening. We will be back here with a newscast later this week that drops on Friday. I'm Stacey Sims. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.